There are two main ways for determining the platelet concentration in blood, and they are the automated platelet count and the estimated platelet count. The automated platelet count is the platelet concentration that the hematology analyzer produces, and this is a much more accurate platelet count when there are no platelet clumps. However, if there are platelet clumps, then the analyzer does not count all of the platelets within the clumps. It only recognizes the individual platelets. So if there are platelet clumps, then the automated count is considered the minimum platelet concentration. The estimated platelet count is the platelet concentration that you get by looking at a blood smear. This count can also be inaccurate if there are platelet clumps, and that's because the platelets will be unevenly distributed on the smear. But it is a good way for confirming thrombocytopenia if you don't have clumps. The estimated platelet count is calculated by multiplying the average number of platelets per 100x field times 15,000. Now, the problem arises when there is platelet clumping in the sample, and that's because platelet clumping interferes with both methods. And unfortunately, some patients, especially cats, have platelets that just tend to clump in vitro. But you can also have platelet clumping with traumatic sticks. So when there is platelet clumping, it's best to just look at the smear and give a quantitative estimate as well. Overall, the platelets appear decreased or increased or adequate. And this is something that requires a little bit more practice and skill, so I don't expect you guys to do that in lab. But I do expect you to be able to determine the estimated platelet count when there are no clumps, and also realize the benefits and the deficiencies of the automated and estimated platelet counts.